Doctors of Reddit, what made you say how are you not dead? Not a doctor, but my almost 90-year-old grandma just survived a colon cancer like it was a cold. Not a doctor, but as a nurse I have had conversations with people who have a bowel blood alcohol level of over 0.45, which is not consistent with life. For reference, a DUI is typically 0.08 or higher. I'm a medical scribe, but work closely with the doctors. We had a cancer patient whose caregiver called in to request a refill on morphine drops as they were almost out. The problem was that the prescription was for a 30-day supply and they had only had it for a week. The patient is hospice, meaning they will be dead soon, so the doctor agreed to refill the medicine. We figured the caregiver had been dosing more often than the prescribed 3 times a day, so the doctor said we'd increase the amount per dose, since clearly the original prescription wasn't working. A couple hours later we get a call from the pharmacy. The caregiver is saying that the dosage has been lowered, not increased, which makes no sense. The original prescription was 0.5 milliliters 3 times as a day as needed for pain, and this one was for 1 milliliter. Literally double the original dose. The pharmacist has a brilliant idea and asks the patient to mark on the enclosed dosage cup where they are filling it to for each dose. Turns out, they've been giving the patient 5 milliliters 3 times a day. The doctor was shocked. That's much higher than the recommended dose, and it's very lucky that the patient didn't stop breathing from an overdose. My friend got this a lot. She spent years making frequent trips to the hospital to be treated for sepsis because her kidneys were fucked. Just had surgery a few months ago and is finally living life as though it is going to last. Also, my brother got this after his car accident. The doctor reckoned skinny jeans are the reason he didn't bleed out when his femur tore out a chunk of his femoral artery and he was stuck in the car for 2 hours before first responders got him out. Thank God for skinny jeans. Mexican doctor here. When I was in 4th year of med school, I was doing a shift in the ER of our training hospital. As students in my school, we were required to do shifts due to lack of personnel to do basic stuff like taking blood samples, placing Foley catheters, etc. One Saturday morning, around 10 probably, a patient walked in with a knife stuck on the side of his head, temporal area. Guy just walked in, knife stuck on his head, talking normally and everything. Everyone was absolutely puzzled. Guy turned out to be a construction worker who got in a fight with a coworker. Patient tried to hit coworker with a shovel. Coworker dodged it and stuck the knife in the guy's head. Coworker freaked out and ran. Patient looked for a taxi, couldn't find one, decided to go ahead and take a 40-minute bus to the hospital. As you do. They took a cord scan. Impossible to interpret obviously because of the metal, and they sent him to the OR to be taken out by a neurosurgeon. I heard later that the knife had apparently gone inside only a few millimeters on a venous sinus and the knife got stuck in the bone. Guy was checked out next day or something. Crazy. Not a doctor, but my big sister had a Wolff-Parkinson-White syndrome that remained undetected until one day her heart eventually just stopped. She got reanimated more times one should be able to survive to and eventually ended up paraplegic with memory issues. Doctors told my parents they just couldn't understand how she survived it without ending in a persistent vegetative state. That was 10 years ago now, and she's perfectly fine in a wheelchair. Even her memory troubles eventually became very slight compared to what it used to be. Friend's dad is a trauma surgeon. A man came into the trauma center via ambulance with an amputation of his left ankle and a partial amputation of his leg, among other issues, severe bleeding from his femoral artery and multiple other crush injuries. Honestly, he was so surprised that he was conscious and talking and he actually ended up surviving, but had to have a few amputations and multiple surgeries. Not a doctor, but an EMT. Got a stroke call for a semi-elderly lady. We show up to the apartment and my partner goes to perform a stroke test and assessment on the woman. I begin to talk to the patient's daughter, who is also the caretaker. I ask if she was prescribed any medications, specifically for her heart, and she pulls out this bag with maybe a dozen or so bottles, and says most are for her heart. I begin to look through, and I see medications for high cholesterol, high blood pressure, CHF, arrhythmia. I mean, this woman's heart was terrible. So I ask the daughter if her mom had been taking her meds recently. She laughs a little and says of course not. Not in months. I look a little wide-eyed at her and I ask, then what H's has she been taking? She pulls out 2 bottles from her pocket. One is Street John's Word, the other is an organic thyroid medication. Turns out the daughter is a holistic medicine therapist and doesn't believe in modern medicine or, apparently, heart disease, and she first noticed her mom's stroke symptoms 12 hours ago. When positive thinking, deep breathing and counting backwards from 100 didn't work, they called us. At this time, my partner comes back out and says we had to move. Half this woman's face looked like she was melting, and she had no movement in her left arm or leg. The nurse chewed the daughter's ass out at the hospital. Never found out if that woman made it. TL. Doctor daughter tried to get mom to think the clot out of her brain. Nothing that was with another person, but I have some moments for myself, personally, where I should have died. In 7th grade I went to the hospital for an eating disorder. My heart rate was at 12 BPM, not just for a second, but consistently at 12 BPM for hours, or days, probably. Last year around this time I was sick, and one thing led to another, but at some point I ended up having something like 6,000 platelets left in my blood. For reference, I should have had 300,000. If they were to drop any more, to be at 3,000 I would have died of a brain aneurysm instantly. The doctors never got to the bottom of what the heck happened, but were able to get my platelet levels back up to normal with a high protein diet and medications. That same time last year, as above, like I said, there were a billion things happening like dominoes. Anyways, another thing that happened was that my body was going into havoc and I didn't pee or poop for over 2 weeks. In addition, my body held on to all of this water as well as much more, until I eventually accumulated 40 lbs of water weight. Again, this was in a matter of days that this happened, and my skin was stretched so far that I was in constant pain. Like a literal torture system of being filled with water. This was also a puzzle to the doctors, and to this day nobody knew what the heck was happening. There were a billion things that all happened during this chaotic meltdown of my systems last year, but these two were probably the most life-threatening. We had a guy come in with a swollen stomach, no pain, essentially normal vitals. Court scan showed signs of poor blood flow to the bowel. We took him back to surgery, opened him, and found everything from his stomach to the colon was dead. There was partially digested food floating around his abdomen. Closed him up, and told the family he had an unsurvivable injury, but this dude lived essentially normally for another few days before finally deteriorating. Just insane. I'm still not sure how he survived so long with his entire gut dead. Not a doctor but a nurse. People who were newly diagnosed with it who had 5 CD4 cells. Like, they didn't have any opportunistic infections, no pneumonia, minimal skin problems, no meningitis. Maybe one incident of thrush in the past year, but no other overt sign of infection. They've just been walking around with a completely dysfunctional immune system and still didn't get sick. It's uncanny. I've seen it 3 times now in new infections. One of the things you learn as a doctor is that a single disease can look very different in different people. I met a gentleman who had a very large blood clot in his lungs. This caused his heart to stop on 3 separate occasions in a few hours, and each time the medical team brought his heart back into a normal rhythm. He needed full life support, breathing machine, medications to raise your blood pressure, all the works. He unfortunately died. A different guy I met the day before had a very large blood clot in his lungs. He was fully conscious and looked normal. He had a slight funny feeling in his chest. Never needed a breathing machine or any life support. Went home in a couple days. Both blood clots were about the same size and in the same area. My father survived a month with a burst appendix. Finally got it removed after a cut on his finger wouldn't heal up. He's doing fine now. It's the golden rule of Reddit that if you ask a question beginning with doctors of Reddit, then at least 90% of answers will start with not a doctor. Not a doctor. My uncle survived a car crash with the truck going 80 miles per hour. He had broken every rib, 2 legs, 2 arms, dislocated shoulder, broken collarbone, and long-term memory loss. He is now alive and well, taking 4 tablets a day, and he has gained his long-term memory back. Plus, he's not even in a wheelchair, he just has one crutch. 2 years ago, I was in a huge car crash. We were T-boned by a transport truck. I was the passenger. Our car rolled over, and the pictures I saw of the car's remains. There was no passenger seat anymore. The whole side was crushed. I don't remember the accident, or the 3 months following it. Woohoo, amnesia. But supposedly I had to be cut out of the car, and airlifted to the hospital. I don't have too many details about that part. I had a broken hip, a lacerated kidney, some other organ damage, I forget, a huge crack in the back of my skull, and a serious concussion. But I survived a fucking transport truck. I wasn't able to walk for a while because, you know, broken hip, but after a while, the ligaments that had been damaged reattached themselves to some other part of my hip. I'm not a doctor, so my understanding is limited. But here I am, walking again. I did not have to get surgery, I did not have any lasting brain damage, and 2 years later, you would never know that anything had happened to me. It's basically miraculous. Not a doctor, but my dad was shot 15 times while on vacation, and the last one was to the back of his head, execution style. He's still alive and currently playing Division 2. Not a doctor, but I was a how are you still alive patient. 4-month hospitalization for necrotic pancreatitis. When I was admitted I had lipid bumps, the lipids in my body literally trying to escape through my skin because my body wasn't processing anything. Hypertriglyceridemia barely begins to describe it. My triglyceride levels were over 100 times normal. When I was admitted, and I was doped up on morphine, they told my wife there was a very high likelihood I would be dead in 48 hours. And that doesn't even add in how at one point, because of all the stuff going on, including internal abscesses, while I was suffering from pleural effusion, fluid around the lungs, my lungs filled up with fluid as a result of an allergic reaction to medication. So I almost drowned in a hospital bed, and then have 3 days I don't remember, and woke up in the ICU. When I woke up I had been intubated, tubes sticking out of my chest for fluid drainage, of course waste tubes, and another tube sticking out of my back that went into my stomach, to drain the massive abscess that had formed. I remember the day I came home. I had to go for tube checks on the back tube every few days, to make sure it was still doing its thing, and not infected or anything. They were going to send me home with the tube still in and have a nurse come every day to check on it. They had me go down for one final tube check, and the surgeon who always did those checks, I never got a name, but she was such a wonderful woman. When I went to a tube check and the nurses didn't give me painkillers, she freaked on them. She discovered that the abscess had collapsed, and they could remove the tube. I remember her coming over to me, pulling down her mask with this huge smile on her face, and looked like she might have been tearing up, and just said, "You gave us so many scares, but it's over now." Not a doctor, but at the time, when my mom was little, my grandma took her to the doctor, and he told her to give X medication once every 8 hours, and to come back whenever she ran out of meds. Grandma went back the next day for more. Enough said that the doctor was pretty confused. She had pills for like 3 days. Instead, she gave my mom 8 pills every hour, almost killed her. I wonder that about myself a hell of a lot. When I was 6, a group of kids tried to kill me on several occasions. One time they tried throwing me down the stairs. Another time they tried to drown me. Once they tried to strangle me. And finally one kid pulled me down from a top bunk so hard that I hit my head and lost consciousness. I've also had about half a dozen suicide attempts or so. I got the ever living shit beat out of me for 4 years. I self-harmed for several years, and I ended up 2 stone underweight from anorexia for 2 years, but it almost didn't even show. No idea how I'm alive, but I'm now suffering from poor memory, sound processing issues, joint pain, and muscle weakness at 24 years old. I can't help but wonder if it's the result of the crazy amounts of abuse my body has taken. This one is more of a how the fuck did your body do that instead of how are you not dead thing that happened with my uncle. I'm definitely not a doctor, but I heard most of the details of this thing. My uncle is a healthy guy who has a habit of just eating whatever he likes as compared to drinking, smoking or any kind of drugs. He and my aunt once went to visit his son living in us at that time. and he had been complaining of chest discomfort for quite a while before the trip, but once he got there it got a bit worse, so they took him to a doctor. The doctor asked for a few tests to be done. Cue all the tests completed, and the results being given the doctor. The doctor nearly dropped the test results when he got to the third page or so and called for a nurse. Nurse came in, and he pointed to my uncle and told her to prep him for surgery. Everyone got scared, but the doctor said it was more of an exploratory thing to check if something the tests showed was right. The surgery happened, and uncle had no chest discomfort after the surgery, and a lot of doctors had come by to visit him. Puzzled by all that, my uncle asked the first doctor he met why so many doctors had come to see him. Turns out my uncle had what you would call a natural bypass. One of his arteries was clogged up, so his body just decided to send it another way. If that natural bypass had not happened, my uncle wouldn't have even gotten on the flight to come to the US and would have been 6 feet underground. To put it mildly, the surgery was just cleaning up of what was clogging the artery, so the natural bypass was no longer needed. TL. Dr. Uncle complained of discomfort while visiting son and found from doctor that his own body saved him from dying. Not a doctor, but, not a doctor, but, not a doctor, but.